evening, friends. This is Dr. Chetna Jain. I have joined Cloud9 Hospital Sector 14 as Director in Obstetrics and Gynecology. Today, we are going to talk about fibroids. Now, what are fibroids? Fibroids are soft tissue tumor of the uterus. They're a very, very common phenomena. Fibroids are essentially non-cancerous. That means if you have fibroids, you don't have to worry. 99.7% of the fibroids are non-cancerous. It's only 1 in 300 chance that some fibroids can convert into something serious. So it is important to know what kind of fibroids you have and what could be the potential management. So fibroids are typically seen around 30 years of age, but they can continue to be seen till the age of 50. Sometimes women after menopause can also show fibroids. If the fibroids are growing after the menopause, this could be something serious. But if the fibroids are present at a younger age, they tend to disappear after the menopause. And if they are medium in size or a location is so comfortable that they do not cause any problem, then the pregnancy, childbirth, breastfeeding, menstruation, everything remains so comfortable. That means not all fibroids need treatment, not all fibroids need removal. So there's a lot of myth about it that if there's a fibroid, this needs to be removed. Women are too worried about tumors in the body. So please be assured that fibroids alone do not cause any problem, but their location, numbers, sizes, these are relevant things. Now, if we talk about fibroid, there are three kinds. One which is sitting inside the uterus, we call it a submucous fibroid. So the fibroids which sit inside the uterine cavity can lead to heavy periods, bleeding between periods, difficulty in conceiving, preterm labor, and other problems. And these fibroids typically need removal, but majority of these fibroids can be removed through the vaginal route. Then you have fibroids which are within the wall of the uterus. These are known as intramural fibroids. Now, intramural fibroids may vary in size from a couple of millimeters, like 3-4 millimeters, to a couple of centimeters. The sizes typically are around 4-5 centimeters. If they are away from the uterine cavity, they do not cause any pressure, they do not increase the bleeding, and they can be just left alone or monitored by regular ultrasounds. Now, the frequency of monitoring can depend on where the fibroids are, how the symptoms are, what is the desire of fertility, and whether the patient is too much worried about them, and certainly the age of the patient. There are other fibroids which are outside, and sometimes they grow as large as the uterus itself, a pregnant uterus. Sometimes they turn into a kilo, 2 kilo, 3 kg fibroids, and women are unaware, especially fatty women. They would not know if they are carrying such big fibroids. The thinner women can actually feel swelling in the abdomen. So what could be the symptoms of fibroids? Fibroids can give rise to abdominal swelling, can give rise to heavy periods, bleeding between periods, urinary retention, and difficulty in passing stool, that is constipation. So these are some common symptoms. The most common symptoms are heavy, prolonged periods. These are the most common. Now, what is the treatment of fibroids? So fibroid, or maybe before that, we can just talk about what do we do if we have fibroids. So first of all, if you think that you have fibroids, you see a gynecologist. Your gynecologist is going to order, they will first examine you. So what kind of examination? First, you're put on the bed and an abdominal examination is conducted, which will tell us about the size of the uterus, if it is very big. If it is a medium-sized fibroid or it's a small fibroid, it will not be well on the abdomen. Fatty women, if it is difficult to feel the fibroid, thinner women, we can feel the fibroids easily. Then an internal checkup, which is known as vaginal examination or PV examination. So bimanual examination is done through the front passage, and this can tell us about the size of the fibroids. So if the woman is thin, it is felt very easily. If the patient is of medium size, still we can make out. But if the woman is extremely obese, small fibroids can get missed on clinical examination. So the most common investigation which is performed for fibroids are ultrasound. So ultrasound will tell us the exact location, size, and numbers. Sometimes fibroids do get confused with another condition, which is known as adenomyosis. Adenomyosis is another condition in which the lining of the uterus grows within the uterine wall and gives rise to tumor kind of structure in the uterine wall. Now, adenomyosis leads to more painful periods compared to fibroids. Fibroids can also lead to painful periods if the fibroids are located in the uterine cavity. Uh, on occasions, if there is confusion between a solid abdominal tumor and fibroid, an MRI pelvis with contrast can also be recommended. MRI can be done safely during pregnancy. However, contrast giving is not recommended during pregnancy. But most of the women would not need any advanced investigation, and we can just manage the diagnosis by clinical examination and confirm it by ultrasound. Now, the treatment of the fibroid depends on the desire of the person. So, and also the symptoms. So, we talk about the pain. So, if somebody is having no other problems, but only slightly painful periods, then what we do is we just give them some pain relief. So, this pain relief can come in the form of various painkillers that are available normally, and you must be aware like mefenamic acid, which is the most commonly used, and there are other drugs also, so they can be used. Then there are other medicines which will cause some platelet clumping of the vessels in the uterine walls and reduce the flow. So women who have heavy periods or painful periods, so if we reduce the amount of bleeding, the pain will also become less. So these kind of medicines can help in reducing the flow. So those who have heavy periods, by giving such medicines, the flow can be reduced by as much as 25%. When we use a combination of these two, like the painkiller, as well as these medicines which form microclots in the uterine blood vessels, causing platelet clots and reducing the blood flow. So altogether, it reduces the flow by about 40%. So a lot of women who are getting up middle of the night to change, if they sleep through the day and they just sleep through the night and change through the day, then their life becomes so comfortable that they probably do not need more than that. Then it also depends on the fertility desire of the patient. Suppose the fibroid is small and it is not causing any problems, but is still sitting inside the uterine cavity, then this fibroid will definitely need removal because it is interfering with fertility. And there could be fibroids which are causing arrested growth of the baby. If they are too large and occupying the space in the uterine cavity, the baby will be compressed, baby will have less space. Such fibroids are it's uncommon to see such large fibroid in the uterine cavity, which would actually compress the baby. However, these fibroids can lead to malpresentation. That means the baby may not sit head down, and it could be a transverse lie or a breech position, and a large fibroid can interfere with normal delivery sometimes. Though majority of the fibroids do not cause much problem and women end up normal delivery. In fact, all the obstetrician would prefer the women with fibroids should have normal delivery because at cesareans, the bleeding is a little more than the routine cesarean section. So it is very good that if somebody has fibroids, we encourage them to be able to remain active so that the pelvis becomes soft and everything remains good at the time of delivery. The delivery becomes easy, and we don't need to do anything, and the fibroids, they shrink. Yeah, so here it's an important point that during pregnancy the fibroids may grow. A 5 centimeter fibroid can actually become a 10 centimeter fibroid. The rate of growth is not fixed. Some people will grow by just a centimeter or so, and others may actually double up their fibroids. Majority of these fibroids will go back to normalcy after the delivery. So there could be certain pain, or degenerative changes. That means certain changes in the fibroids, which makes the fibroid very hard or very soft. So these changes can increase during pregnancy, and depending on the situation post delivery, it is decided whether they can be staying inside or removed. A lot of you request about removal of fibroid during cesarean section or at the time of delivery. It is not recommended anywhere in the world to remove fibroids at the time of childbirth. So I request all of you to avoid doing that. It may lead to severe damage in terms of loss of the uterus because of the significant bleeding at the time of operation. So a lot of doctors perform such kind of heroic things, but most of the colleges and institutes, they do not recommend the surgery of fibroid at the time of pregnancy. It is always done before the pregnancy or at least 6 weeks after, depending on the symptoms. Uh, so we talked about management of pain, management of bleeding. Then if the girl is very young and she has fibroids, we try certain hormones. We can start with pills. These pills are taken from day 5 of period, from day 25, and they have to be taken same time every day. These pills, when taken regularly, can arrest the size of fibroids. There are other medical management which are also available. So these medicines are given regularly, and they are expected to shrink the size of fibroid by 25 to 50%. And if this can control bleeding, and during that time, if the patient can conceive, or if the patient can achieve menopause, then the treatment is almost completed. For others, if the fibroid recedes into the uterus, then Mirena can be inserted, which will control the bleeding. So various combinations of the treatment can be used, because the idea is to preserve the uterus, to preserve the fertility, to control the symptoms, to improve the quality of life. So these are the most important criteria when the fibroid is looked into. So we were talking about the medical treatment. So this is contraceptive pills that we day 5 to day 25, and then it can be taken over a couple of months. Then you have this ulipristal, which can be given, and the results are expected to be good. There are other medications which are also expected to improve the size of fibroid. Mifepristone is one of them, but not really available because it is an abortifacient also. So minded medical treatment cannot be used by those who are attempting a pregnancy during that time, because majority of the treatment of fibroids will prevent pregnancy. However, pregnancy can still occur while taking the medication, and it is advisable to use protection, because a pregnancy which occurs on medication of fibroids will not be is likely to be problematic, and it is expected that the women will use added protection and will not conceive while they do medical management of fibroids. Then there are monthly injections available which can be taken. These injections are given once a month. Maximum they can be given for 6 months. Typically they are used for 3 months. These injections are used by women who are trying to shrink the size of the fibroid and controlling the bleeding till the time they build up their hemoglobin, because a lot of you will lose a lot of blood and the hemoglobin drops, and before the surgery we need some X amount of hemoglobin. The minimum requirement is at least 10. So if it is less than that, by giving these medicines, we arrest bleeding in a significant way so that the hemoglobin builds up. The fibroid also reduces in size, and sometimes a very large fibroid can become a medium-sized fibroid, and the surgery which was to be open can actually get converted into a laparoscopic surgery. So these are various medical management, and there are some extraordinary medical management which are not much in use, still under discussion. So one is a focused ultrasound. So the focused ultrasound treatment can reduce the size of the fibroids. A lot more study and research is required before this treatment can be regularly advocated. Uterine artery embolization. Uterine artery embolization is a method wherein the blood vessels which supply mainly to the uterus, they are blocked by gel form or other particulate matter, so that the blood supply to the uterus is reduced. Since the blood supply to the uterus is reduced, the size of the fibroids will shrink. It can lead to some pain and abnormal uterine bleeding for some time, but thereafter the fibroids will shrink. The shrinkage can come to the significance of 25% to more than 50% shrinkage. So it is done through the femoral root or through the brachial root. The femoral root is more common, wherein the vessels in the legs are catheterized and the gel foam is inserted from this under the X-ray guidance so that it blocks the uterine vessels. The effect comes slow and a good effect is seen for a maximum of 1 year. But it cannot be advocated routinely. It has its own complications, as for example, dislodging of the clots, and its effect on future fertility is still studied. There are many reported pregnancies, but it is still not certain. So it is good for women who are unfit for major surgery, and also for women where the uterus is completely buried into the various adhesions. It's a frozen pelvis kind of situation, and on surgery, the uterus is not accessible. Any kind of surgery leading to a bladder damage or a bowel damage is expected. So for such women, uterine artery embolization can improve the quality of life. So this is an option, limited role, but useful in certain unique cases. The final treatment of fibroid remains, which is a gold standard, is the surgical management. Now, a lot of women over time, because of the advancement in the medical management, are able to conserve their uterus, but still there are a few who would need the surgical management. The surgical management can be done in two ways. One is you just remove the fibroid. So this is suitable for women who have 1, 2, or 3 fibroids. But when there are multiple fibroids, and it's very hard to remove, and sometimes it's a little dangerous. Though all of us have removed multiple fibroids in terms of 40, 50, or 60, especially in women who are of African origin. So these women, they tend to have multiple fibroids, and they are able to conserve their uteruses. But these many, and if I show you the pictures, they are so interesting to see various sizes of fibroids starting from 12 centimeters to a couple of millimeters. And when we spread them post-operative on a paper, they actually occupy probably 2 by 2 feet of a space completely filled. So women and their uteruses are reaching almost up to the breast. So these kind of large fibroids they are very hard in nature, and these are seen in African women. In Indian women, the fibroids are seen. We do not see so many fibroids. They are seen, but they are like generally 4, 5, 6, 10, or maybe solitary fibroids. The majority of these fibroids can be removed laparoscopically. There are certain criteria that you have these sizes and these numbers only. A laparoscopy can be used to remove the fibroids, otherwise an open surgery is required. So removal of the fibroids from the uterus is known as myomectomy, which can be done through 3 routes. One is the vaginal route, which is done for the fibroids which are within the uterine cavity. So these are submucous fibroid, and they are removed through hysteroscopy, and it is known as hysteroscopic myomectomy, that you insert the camera through the front passage into the cervix, then into the uterus, and you shave off just the way you shave off the potato, you could peel the potato. So similarly, we peel the fibroids and bring out the chips. So from a 4 or 5 millimeter dilatation, we cannot bring out the whole fibroid, but we can bring out these chips. So this is how the fibroids from the uterine cavity are removed without actually cutting the abdomen open. So here also the fibroids could be of 2 kinds, wherein they are popping completely into the uterine cavity, and there are others which are half into the uterine wall and half into the cavity. So those which are in the cavity, so they can be removed. The portion which is inside the uterine wall, this cannot be taken off completely from the base, and sometimes a 2-stage operation is required, because if you do everything at the first sitting, there are increased chances of perforation of the uterus, and it is not recommended to complete the procedure in first go for some cases. For majority, if it is a fibroid polyp kind of structure, it can be removed through hysteroscopy beautifully and without any scarring. And the woman, after the experience, if she wants to attempt a pregnancy, she can go ahead and attempt a pregnancy, and this will never interfere with normal delivery or anything. So, hysteroscopic myomectomy for submucous polyp fibroid is a very beautiful thing. very commonly performed and available in almost all hospitals. Then comes the intramural fibroids. So if the numbers are less and the sizes are not very big, they are removed through laparoscopy. So laparoscopy is also known as keyhole surgery. A lot of people mistakenly call laparoscopy as laser surgery. Laser is a technique, it's an energy source. Laparoscopy means a keyhole means we insert tiny cameras and equipments into the abdominal cavity and excise these fibroids. Now, if the fibroids are large, now they cannot come out through the small punctures, which are 5 or 10 mm, and in this slide, a 12 puncture is performed, and the fibroid is cut into pieces in the abdominal cavity and then removed. And this process is known as morcellation. So, morcellator is a separate equipment available along with laparoscopy, and this procedure is done at the end of the excision of the fibroids from the uterus. So, X number of fibroids, depending on the expertise, can be removed. And laparoscopic surgeries, they give very good results. The hospital stays less, the bleeding is less, the recovery time is fast. So this is typically reserved for women who need to preserve their fertility and to have future reproduction, and who have limited number of fibroids and their location is conducive for laparoscopic surgery. So then there are external fibroids, which are known as subserous fibroids. They can also be removed through laparoscopy. If they are very huge, some patients would prefer open surgery. There was a lot of controversy a couple of years back, wherein some fibroid was removed through laparoscopy, and the cancer was not excluded, and it upstaged the disease, and for several months rather in United States, because they were very vocal about the whole thing. So morcellation was banned. So there's some controversy, and if you think before doing your fibroid, if you think you do not want morcellation, then you should think about options which we can discuss as and when, depending on the case of the patient. Lastly, hysterectomy. So hysterectomy is typically a total hysterectomy, which can be done through laparoscopy or through abdominal route. Abdominal route is less commonly used these days. Majority of the women will complete, the doctors would use laparoscopic hysterectomy. This is known as TLH, or total lap hysterectomy. The preservation of the tubes is not done. Most of the women who are removing the uterus, it is best to remove the tubes also. This reduces the chances of cancer further. But ovaries can be left inside, one or both, depending on their condition and maternal age, the patient desire and symptoms. So if the patient is having symptoms like endometriosis and other things, and the periods have been very painful and there's a chronic pelvic pain, sometimes ovaries can be removed at a younger age. Otherwise, the age limit of the removal of ovaries kind of universally, but there's no rule of thumb, is about the age of 50. Between 45 and 50, the choice is between the physician and the patient. So there has to be an informed choice whether the patient wants to remove her ovaries or no. Remind it, all those who haven't reached menopause and removed their ovaries will have a surgical menopause and acute flushing and symptoms of sudden menopause. These ovaries are functional for a long time. Even if the uterus is removed and the ovaries are left behind, these ovaries will achieve their natural menopause at the right age, and during this time they will supply adequate amount of estrogen to the body, which are protective to the heart and to the bones. It is also good for skin, hair, and this libido. So unless it is absolutely essential, it is best to preserve the ovaries till the age of 50. Thereafter, if the symptoms appear, then if the HRT can be given. Now, the fibroids which could be serious will be the fibroids which will grow after menopause. It is important to rule out cancer, MRI with contrast, PET-CT. These are various tests which can actually figure out if the fibroid could be cancerous, and these are known as fibrosarcoma. These are very, very rare conditions. So, not commonly seen, more common in women who are postmenopausal So if the fibroids are growing after the menopause, it has to be attended to immediately, and fibromyosarcoma needs to be ruled out. For younger women, the fibroid may grow slowly or rapidly. Different women will grow it differently. Somebody might be having a fibroid of 5 centimeter, stays like this forever, and she never needs any treatment. Others, they notice it was 2 centimeter, and in no time it becomes 20. And these are the fibroids which would eventually need removal. The best advice would be, as soon as you identify something, monitor it, go to your doctor, complete your family so that there is no hindrance later on. It is always important to complete your family before actually you touch your uterus, but sometimes if it is interfering with fertility, then fibroid has to be removed first. But there is some risk involved there, and I recommend that if you have fibroids which are going in the wrong location, just try to complete your family so that the work of the uterus is over. I'm not suggesting that you get rid of the uterus, but just in case you end up using for some bad reason, at least your family is complete. So if you have any questions here, if I, so I'll be glad to take it. So sorry, the letters are too small and I'm not able to see. नमस्ते डॉक्टर, वाइफ को फाइब्रॉइड है और 4 मंथ्स तक टैबलेट खाने के बाद भी ठीक नहीं हुआ। डॉक्टर बोल रहे हैं ऑपरेशन के लिए, तो मैं क्या करूं सर, प्लीज बताइए। आप जो कह रहे हैं वो बात ठीक है कि अगर 4 महीने दवा नहीं खाने के बाद हो सकता है कि आपको डॉक्टर बोले कि आप यूट्रस निकालें, लेकिन ये डिपेंड करता है कि आपकी वाइफ की एज कितनी है, उनका फाइब्रॉइड कहाँ पर है, उनके सिम्टम्स कहाँ हैं, उनको यूट्रस की क्या जरूरत है, उन्होंने क्या क्या मेडिसिन ले लिया है, और उनका कितना ट्रायल हो गया और उस मेडिसिन से उनको कितना फर्क आया है। तो अगर हमें ये सारे डिटेल्स मिल जाएं तो हम आपको और बता सकेंगे। लेकिन मैंने आपको इतने सारे ऑप्शंस बताए, इसमें 3 तरह की टैबलेट्स हैं, कॉन्ट्रासेप्टिव पिल्स हैं, मेफिप्रिस्टोन है, यूलिप्रिस्टिल है, जीएनआरएच है। अगर इसका लोकेशन बाहर है तो मिरेना है, तो आप ये सब ट्राई करके देख सकते हैं। अब मैं आपको इंडिविजुअली तो प्रिस्क्राइब नहीं कर सकती, क्योंकि ये कंसल्टेशन इस तरह से नहीं दिया जा सकता, अलाउड नहीं है, लेकिन ये ऑप्शंस आपके पास रहते हैं और आपकी केस के हिसाब से ये देखा जा सकता है कि इनमें से कोई ऑप्शन अगर आपको फिट होता है और आपको थोड़ा टाइम और निकल जाए तो ऐसा ट्राई किया जा सकता है। मैम, मेरी मॉम का ऑपरेशन हुआ है, 6 महीने हो गए, पर उनके पेट के नीचे हिस्से में बहुत दर्द रहता है, पेट बहुत भारी सा हो जाता है, खींच बहुत ज्यादा पड़ती है, प्लीज सजेस्ट करिए आप। तो आप ये कह रहे हैं कि आपकी मॉम का यूट्रस निकल चुका है और उनको पेट में दर्द रहता है, तो आपको एक अल्ट्रासाउंड करा के देख लेना चाहिए कि अंदर में कोई चीज चिपकी भी तो नहीं है। अगर उनको ऑपरेशन हुआ है तो क्या निकाला गया है, यूट्रस निकाला है, ओवरीज निकाला है, या क्या निकाला गया है। और उसके बाद में अल्ट्रासाउंड से और एग्जामिनेशन से ये पता चलेगा कि उनका प्रॉब्लम क्या है, और उसके बाद उस प्रॉब्लम को सॉल्व किया जा सकता है। क्योंकि अगर ऑपरेशन को 1 साल हो गया तो उसके बाद वो फिक्स नहीं पड़नी चाहिए। जितने भी टाँके होते हैं वो 1 साल में तकरीबन पूरे जुड़ जाते हैं। तो आप एक अल्ट्रासाउंड करा के किसी डॉक्टर को दिखा लीजिए, तो आपको पता चल जाएगा कि अंदर में क्या प्रॉब्लम चल रहा है। मैडम, अगर फाइब्रॉइड हो तो ऑपरेशन के बाद बेबी के कितने चांस हैं, और थायराइड ग्लैंड भी हो तो बल्कि 16 एम में हो तब कितनी चांस हैं ऑपरेट के बाद। 16 एम समझ नहीं आया, प्लीज रिप्लाई मी, फिलहाल कोई बेबी नहीं है। मुझे आपकी 16 एम की बात तो समझ नहीं आई है, लेकिन फाइब्रॉइड के बाद सभी लोग तकरीबन कंसीव कर सकते हैं। फाइब्रॉइड अब तो तभी निकाले जाएंगे जब किसी को फाइब्रॉइड की वजह से कंसीव करने में दिक्कत आ रही है। अगर फाइब्रॉइड कैविटी के अंदर नहीं है और वो आपको कैविटी के अंदर पुश नहीं कर रहे हैं, आपके डॉक्टर लिखेंगे अल्ट्रासाउंड के अंदर नॉट इंडेंटिंग द कैविटी, नॉट इनसाइड द कैविटी, तो ऐसे फाइब्रॉइड को निकालने की कोई जरूरत नहीं होती। आप अगर आपका 10 या 12 सेंटीमीटर का भी फाइब्रॉइड है और अगर वो ज्यादा परेशान नहीं कर रहा आपको, तो आप उसी के साथ प्रेगनेंसी कर सकते हैं। लेकिन अगर फाइब्रॉइड बहुत बड़ा है और वो आपको तंग कर रहा है तो उसे निकाला जाना चाहिए। अब वो कैसे निकलेगा उसको एग्जामिन करके देखा जा सकता है। पहले ये डिसाइड करना होगा कि निकालना जरूरी है कि नहीं, क्या इसके साथ प्रेगनेंसी की जा सकती है, क्या आप अभी प्रेगनेंसी के लिए राजी हैं। अगर आप राजी हैं तो कर लीजिए, नहीं राजी हैं तो फिर हमें देखना पड़ेगा इसकी लोकेशन क्या है। वैसे अगर फाइब्रॉइड निकालने के बाद हमारी सलाह ये रहती है कि 6 महीने के बाद ही आप प्रेगनेंसी ट्राई करें। इसमें दो तरह से होता है, अगर कैविटी खुलती है तो उसके बाद अगली डिलीवरी आपकी ऑपरेशन से होगी, और अगर कैविटी नहीं खुलती है तो नॉर्मल डिलीवरी के थोड़े चांस बनते हैं। तो ज्यादातर लोग जो भी सर्जरी करवा लेते हैं उनके फाइब्रॉइड की सर्जरी के बाद नॉर्मल डिलीवरी के चांस घट जाते हैं। तो अगर आपका फाइब्रॉइड ज्यादा तंग नहीं कर रहा है तो आप किसी के साथ प्रेगनेंसी कर लीजिए और डिलीवरी के बाद उसको निकालने का सोचिए। डॉक्टर, मेरी मॉम की एज 44 है, उनका ब्लीडिंग पीरियड्स के टाइम ज्यादा होता है और पेन भी काफी होता है उनको। समझ नहीं आ रहा है कि ऑपरेशन इज बेस्ट और टेकिंग मेडिसिन विल हेल्प। सबसे पहले आप एक अल्ट्रासाउंड करा के देख लें कि उसका लोकेशन कितना है फाइब्रॉइड का। अगर वो कैविटी के बाहर है तो अब उनकी एज 44 है तो वो हार्मोन तो ज्यादा दिन नहीं खा पाएंगे। हम ऐसा कर सकते हैं कि पहले उनका एक टेस्ट करके देख सकते हैं कि उनका मेनोपॉज कितना दूर है। अगर उनका मेनोपॉज ज्यादा दूर है तो उनका फाइब्रॉइड का ट्रीटमेंट करना ज्यादा जरूरी है। लेकिन अगर लगता है कि उनका मेनोपॉज होने वाला है तो कुछ टाइम हम मेडिसिन से धकेल सकते हैं। जैसा कि मैंने आपको अभी अपनी इस लेक्चर में या जो बातचीत में मैंने आपसे बताया कि जो इस एज पे जो मेडिसिन दी जा सकती है वो 3 से 6 महीने दी जा सकती है। उसमें भी थोड़ा हड्डियां कमजोर होने का डर होता है, इसे महीने का एक इंजेक्शन लगाते हैं। तो अगर उनको इसी बीच अगर 4-6 महीने या 1 साल के अंदर मेनोपॉज हो जाता है तो वो बिना सर्जरी के काम चल जाएगा। अदरवाइज उनकी लोकेशन क्या है, उन्होंने क्या ट्रीटमेंट किया है फाइब्रॉइड का, उसके हिसाब से हम आगे का ट्रीटमेंट डिसाइड कर सकते हैं। जरूरी नहीं है कि उन्हें यूट्रस निकालना ही पड़े। हेलो मैम, मैं 42 इयर्स की हूँ और मुझे पीरियड के टाइम से ब्लीडिंग बहुत ज्यादा हो रही है लास्ट 6 मंथ से। मैंने डॉक्टर को दिखाया तो टेस्ट एंड अल्ट्रासाउंड में फाइब्रॉइड निकला है 18 mm का। इसका इलाज बताइए। देखिए बेटा, ऐसा है कि 18 mm के इलाज के फाइब्रॉइड के इलाज की जनरली जरूरत नहीं होती है। अगर वो वॉल में है या बाहर है तो आपको कुछ नहीं करना है, और अगर वो यूट्राइन कैविटी में है तो आप हिस्ट्रोस्कोपी से निकलवा लीजिए, उसमें कोई प्रॉब्लम नहीं आएगी। अगर आपकी एज 42 है और आपकी फैमिली कंप्लीट है तो आप मिरेना लगवा सकते हैं। अगर आपका फाइब्रॉइड कैविटी के अंदर कुछ नहीं कर रहा है तो मिरेना एक लूप होता है जिसमें प्रोजेस्टेरॉन होता है, वो कॉपर्टी की तरह यूट्रस में फिट हो जाता है। जब जैसे आप समझते हैं कि कॉपर्टी से ब्लीडिंग थोड़ी बढ़ जाती है, मेरेना से कम हो जाती है। मेरेना से फाइब्रॉइड का साइज छोटा भी हो सकता है, तो मेरेना भी एक काफी ठीक ऑप्शन रहता है। अगर पर ये सारे केसेस ऑफ फाइब्रॉइड में यूज नहीं किया जा सकता। तो आपका जिस तरह का फाइब्रॉइड लग रहा है, क्योंकि आपकी एज 42 है, मैं सजेस्ट करूंगी कि आप पहले एक बार अगर लग सकता है अगर आपको मेरेना, तो मेरेना लगवा लीजिए। उसके बाद आप 6 महीने ट्राई करिए। अगर आपको मेरेना से आराम आ जाता है तो उसकी ऑफिशियल लाइफ 5 ईयर्स है, 5 ईयर्स के बाद आप चेंज करवा सकते हैं। तो आपका 2 मेरेना में आपकी लाइफ निकल जाएगी, इन टर्म्स ऑफ मेनोपॉज हो जाएगा, और उसके बाद में आप उसको निकलवा सकते हैं। मेनोपॉज के बाद फाइब्रॉइड आपको कोई तंग नहीं करेगा। मेरी मॉम का फाइब्रॉइड निकल गया था डॉक्टर, दोबारा अभी 15 दिन पहले उनका रिपोर्ट आया है, उसमें कैंसर के सिम्टम्स निकले हैं। डॉक्टर ने बोला है कि कोई दिक्कत नहीं, बट फिर भी टेस्ट करवाइए। फाइब्रॉइड में कैंसर के सिम्टम्स निकले, ये बात कुछ समझ नहीं आई मुझे, क्योंकि या कैंसर जो निकला होगा या तो सर्विक्स में निकला है या फिर यूट्रस की लाइनिंग में निकल सकता है या ओवरीज में निकला है। तो फाइब्रॉइड के अंदर कैंसर होना और ये बाकी जगह कैंसर होने में फर्क है। लेकिन अगर जरा भी डाउट है कि इसमें कैंसर है, तो पहले तो आपको जो स्लाइड्स मिली हैं वो स्लाइड्स आप लेबोरेटरी से इशू करवा लीजिए और उनको उनको सेकेंड ओपिनियन कर लीजिए। सेकेंड ओपिनियन के लिए आप दूसरी लैब में वो स्लाइड्स देते हैं, तो वो आपको रिपोर्ट से कंफर्म करते हैं कि इसमें डिसीज कितना है। उसके बाद में अगर कंफर्म होता है कि इसमें है, तो आपको फिर किसी कैंसर सर्जन को दिखाना चाहिए। गायनी कैंसर सर्जन को दिखा सकते हैं या जनरल कैंसर सर्जन को दिखा सकते हैं या मेडिकल ऑन्कोलॉजिस्ट को भी दिखा सकते हैं। तो वो बताएंगे कि आगे किसी तरह का कोई ट्रीटमेंट लगेगा या नहीं। पर मुझे ये बात थोड़ा कम समझ में आ रहा है कि फाइब्रॉइड के साथ कैंसर है, तो आपको या तो आप एग्जैक्टली पिन पॉइंट करें कि वो कहाँ है, क्योंकि अगर वो सर्विक्स में है तो उसका मैनेजमेंट अलग है, अगर वो यूट्राइन कैविटी के अंदर है तो अलग है, और फाइब्रॉइड में है तो फिर वो कुछ अलग बात है। तो प्लीज आपको ये क्लैरिफाई करना पड़ेगा, तभी हम आपको इसमें और ज्यादा ठीक से राय दे पाएंगे। मैम, यूट्रस इंट्राम्यूरल फाइब्रॉइड का इलाज कैसे करवाएं? आगे चल के कैंसर हो सकता है क्या? प्लीज डॉक्टर बताएं। मेरी मम्मी को इंट्राम्यूरल फाइब्रॉइड है, इरेगुलर पीरियड्स आते हैं, प्लीज सॉल्यूशन बताएं। देखिए आपकी मदर की एज कितनी है, और अगर उनकी एज 54 क्रॉस हो गई है और उनको अभी भी पीरियड्स आते हैं तो ये अच्छी बात नहीं है। लेकिन अगर उनकी एज 54 से कम है और फिर उनको पीरियड्स आ रहे हैं, अब इसमें इरेगुलर पीरियड्स जो हैं वो ज्यादा डेंजरस होते हैं। अब देखिए इरेगुलरिटी कई तरह की होती है। एक हो गए कि पीरियड जल्दी जल्दी आ गए और बार बार आ गए, वो उसमें डेंजर कम होता है। लेकिन अगर ऐसे पीरियड आते हैं, 2 दिन आए, 4 दिन बंद हो गए, फिर आ गए, फिर बंद हो गए, तो उसको ठीक से इन्वेस्टिगेट करना चाहिए और देखना चाहिए। तो आपकी मदर का कम से कम एक पैप्समियर, एक अल्ट्रासाउंड होना चाहिए, उसके बाद में डिसीजन होगा कि उनके कोई और इन्वेस्टिगेशन लगेंगे क्या, और अगर अगर उनमें कुछ निकल आता है तो फिर उनका क्या ट्रीटमेंट होगा, ये उन टेस्ट को देख के ही बता सकती हूँ। फाइब्रॉइड का लोकेशन, साइज, ये सारी चीजें बहुत महत्वपूर्ण है। सिम्टम्स कितने हैं, क्या मेडिसिन से कंट्रोल हो सकता है, क्या उनका कोई वेट लॉस है, उनका हीमोग्लोबिन कितना है, इस तरह के कई सारे सवाल रहते हैं। अगर वो सारे पता चले तभी आपकी बात, तब हम पूरा जवाब दे सकते हैं। So, namaskar दोस्तों, it was a very nice interaction with you. I'm glad that I could answer some of your questions. We hope to see you next week with some more topics. Have a good day. Thank you. Bye-bye.